I grew up in a rural town north of here, Monroe County, Monroeville, Alabama. I had the great fortune of being the child of two educators. And my mother actually had two brothers who were physicians. They grew up outside of Birmingham, Alabama, in what was then a small community called Fairfield in the 20s and 30s and 40s, but now it's more like a suburb of Birmingham. They were able to go off to Howard University in Washington, D.C. for undergraduate work and remain there for medical school. Graduated medical school in the mid-50s at a time when they were not able to return to the state of Alabama and actually have a viable practice. One of them trained in surgery and the other trained in neurology, settling in San Francisco, California, and Detroit, Michigan, respectively. So as a child, even though I didn't see them much, I knew that the opportunity to be a physician was one that was clearly viable because I had family role models there that I would see from time to time, but always hear about, and my mom in particular would push that as a career option, and I guess that stuck. And so ultimately, that was the career option I chose after college, and here I am. So I had the great fortune after high school in Monroeville to actually attend Yale University. Had a football coach pick up the telephone when a Yale coach called, and I ultimately made my way to New Haven and was there for 4 years. Made the decision during that time to become a physician. I was a chemical engineering major. I then ultimately moved on to Columbia College of Physicians and Surgeons in New York City. I considered myself making my way back toward the south, so I made it 2 hours and stopped, and did my 4 years there. During that time, I just became even more committed to making my way back to the south for my training. I also made the decisions that it was important to be in academic medicine. I recognized that a person that looked like me, bringing diversity to the healthcare team was important in how patients were treated and how actually the way we interacted as teammates. So I came back to Alabama to UAB with that goal in mind, and I matched there in internal medicine. I did my residency there, and I made the decision that I wanted to be a nephrologist, which I am, and I stayed there for my fellowship training. During my time there, the path that I sought to become an academician was a path that, from my background, was paved with people who were physician researchers, physician investigators. And so that's the path I put myself on, and I was paired up with a mentor who was an endocrinologist there at UAB and a basic science investigator into mechanisms of diabetes, which is now the #1 cause of kidney failure in this country. So that pairing was very important to me, and in fact I followed him as he made a career move to leave UAB to go to the University of Mississippi, and that's why I started my career as a faculty member there in Jackson, Mississippi at the University of Mississippi. I was moved on. We worked together there for several years. Honed my skills as a basic science investigator. I developed skills as a clinical and translational investigator, and also started my career, I think, as a community engaged investigator focused on health disparities. After 7 years there, I was recruited again by someone who had become another mentor of mine while in Mississippi. Recruited up to Wayne State in Detroit. So it was kind of a unique feeling for me, in that the fact that one of my uncles had his career there as a neurologist, and there was a lot of members of that healthcare community who actually knew him and were friends with him and peers of his as I made my way there and served that community. Continued to work as an investigator, but became more of an administrative role and even more in education. Was there for 4 years until I came here into the role I'm currently sitting in as chair of the Department of Internal Medicine. Again, it was a mentor that I met in my days in Birmingham, who had been the first chair of medicine here at University of South Alabama, Dr. Bob Kreisberg, who was an endocrinologist, and we made that connection. He always kept up with my career. He was back here as Vice President of Health Affairs and Dean when this search opened, and he just gave me a call and said, I don't know if you're ready for this yet, and where you are in your career, it's up to you. I couldn't tell him no, that I wouldn't look, so I came and looked, and ultimately over a period of about 15 months, I ultimately decided to come back to Alabama, really back home to me, to the university in this role.
So you touched on it briefly, but can you elaborate more on how important it is for patients to see, someone that looks like them? Like, how important is that in our community?
Right. Well, I think it's incredibly important and has been for quite some time. Unfortunately, it's a big challenge. I think for me, the best evidence of that importance is the spark I would see in someone's eyes, or a look of surprise, or a look of appreciation when I would walk into the room of an African American patient, even as a medical student, and clearly they were in a position where they did not expect someone like myself to walk in. And then the words of encouragement that I would get from patients who really in many cases were incredibly ill, but incredibly encouraging of me and colleagues like myself to continue on, helps one to do that job, give the dedication that's required to get to where you are an independent provider, and keep a commitment to serving that community. So it's clearly, as was articulated to me, I think most strongly from the patients that I served in every place that I've been. Well, things are changing, but ironically, if you look at the percentage of physicians in this country who are African American, that really hasn't changed for 100 years. That's sad to see. Yes, now, unlike my uncles, I can practice here and I can be a physician leader here in this state. But nationwide, if you look at the number of physicians who are, percentage of physicians in this country who are African American, is not much different at all over the course of the last century. And in fact, so we're talking about 4 to 4.2% of physicians in this country and in medical school are African American. And majority of that 4.2% now is actually African American women. So one of the groups that's receiving special attention are African American men. But the real issue is African American physicians in general, where we have a percentage in the nation of 12 to 13% African American, and less than so we're 1/3 of that percentage amongst the physician workforce, and that's right now looks like it's going to be true for some time to come without significant effort and focus on righting that ship. The same is true for physicians of the Latinx community and physicians of Native American descent. All groups are woefully underrepresented amongst the physician workforce. I think the word workforce is important. Becoming a physician is professional training, but it's also development of a workforce. In order to provide quality care, it is important that you have a workforce that represents the clientele that they serve. There's actual data out there now in several places to show that there is what we call concordance, meaning that the physician and the patient have similar ethnic background, that those relationships tend to be enhanced. Patients tend to have better outcomes. There's more higher likelihood of building trust. 20 or 30 years ago, the National Medical Association, the professional physicians organization for African Americans, recognized that we would not get to that goal. So they started a process of making sure that all physicians, or at least were sensitive to those issues of cultural differences amongst ethnic groups, amongst sections of the country, etc. It's been good to watch that become a primary focus of medical schools and training of physicians at undergraduate medical education level and at graduate medical education level. And I think the goal, though, ultimately is that I think if we can have our physician workforce reflect the nation as a whole, that in the end of the day, we can stop having these conversations. That's probably a few generations away, but I think that's a laudable goal for us to, for which we should aim. Black history is American history. Latinx history is American history. The history of every ethnic group, Polish Americans, Italian Americans, Jewish Americans, Native Americans, is American history. And I think it's important for us to know about it. You know, clearly as an African American, I'm more reflective of what our ethnic group has been through during this time. You know, I'm a person that watches a lot of public television, and one of the things about public television, wherever the month is, whether it's Latin American History Month, whether it's Jewish American History Month a week, whether it's African American History Month, you get more programming around that. You know, there was Asian American History Month a few months ago, and I think we all have the responsibility really to familiarize ourselves with the history and how we got to where we are today. Hopefully we won't make some of the same mistakes going forward. And so I guess for me it's about being more cognizant and more thoughtful of our past and our history, and try to put that toward making a better future for all Americans.